so much for joining us today. I am so excited to start these webinars. It just seems like I don't have enough time in my life to connect with so many of you. I am on a mission and purpose to bring our message out to people like yourselves. When you first get what we call the alphabet soup, whether it's EDS or CRPS or POTS, you know, you go on Google and you put in your diagnosis, and then you get the grim news that really there is very little hope and help. And that message should be turned around in this world. We have the amazing opportunity to have treated around 300 now, really chronically ill people who were given no hope, who had very grim diagnoses. And we've seen so many of you recover. I'm not sure if you guys have seen our Facebook page, The Spiro Clinic. If you haven't, make sure you join that. But when we ring the bell with a patient, when a patient walks up to that bell and they ring it, they feel in their heart that they've accomplished the goal they set out to reach when they came here. And that usually means very little pain to no pain. And so if you see this one thing happen again and again, then you know it's possible. Surely we have better answers than implanting spinal cord stimulators to scramble pain signals, to give opioids, to live on medication, to use ketamine, to disconnect the brain from your body so that your body cannot sense pain anymore. There has to be a better way. And we have seen that way, and we know that there is hope for you guys. So the most important thing I want you to leave with today is a feeling of hope in your heart, that you do have a chance, that your body is amazing. We forget that, especially when we're in pain. You know, we don't sit around and think about the intelligence that it takes to form a baby from a sperm and an egg cell and create this little human being that every second, 37,000 billion chemical reactions are happening inside your body right now, even when you're sick. That is amazing, amazing intelligence. Every day, your body is making 222 billion new cells. So when you go to sleep tonight and you wake up in the morning, you don't have the same body anymore. And if we can change the recipe that is making those cells, you have a shot at recovery. Now, I have to throw out this disclosure and say, we cannot guarantee results. We do not promise that we can heal anybody. And in our world, in chronic pain, there's this, what I call the dirty word, which is cure. It's a very bad word, and we're not supposed to say that. And I'm not saying that today, but I'm here to tell you that our patient that has been out of treatment with CRPS the longest, 8.5 years, has had gallbladder surgery, has had severe trauma, and his CRPS did not reactivate. He's our patient zero. And a little bit about my background. Started off as a chiropractor. I was very unhappy in practice, very bored with what I was doing. And I wanted to be something else. I didn't want to deal with neck and back pain anymore. I wanted to help the worst of the worst. And I always say, be careful what you're wishing for, because Carlos walked into my office. His little baby son was 9 months old at the time, full body CRPS with gastroparesis, which we see a lot in dysautonomia. And every time he had even a tablespoon of chicken broth, he would curl up in horrible screaming pain. And Carlos was suicidal, and his wife begged him to try one more thing. I was that one more thing. So talk about pressure. He walked into my office. At the time, the only tool I had is still part of our system now, but it was the vagus nerve stimulation procedure that I used. We performed it. He left my office that evening, was able to eat a full meal. And long story short, 12 to 14 weeks later, Carlos left my office in full remission and remains there today. If you ask Carlos Jasso whether he's in remission or cured, he will tell you that he's cured, and it has stood the test of time. So the magic that you're looking for is never ever going to come, I believe, in drug form. There's not some secret chemical or procedure out there or thing that they're going to implant to make horrible daily chronic pain disappear. The philosophy with which we're approaching chronic pain has to be different. And when I say different, this is what I mean. When you go to one of your many, many doctors, and usually you guys don't just have one. It's not a straight line from having pain, going to the doctor, now I have my diagnosis, and they have answers for me. That's not your world, as you know. You go from doctor to doctor to doctor to doctor to doctor ad nauseum. And each doctor specializes in a certain area of your body, in one thing. And that's what they're looking at. So maybe they're looking at your nervous system when you go to a neurologist, and then you go to a gastroenterologist and they're looking at your GI problems. The problem is none of them are really communicating with each other or considering that all your symptoms may be related. When you come to our clinic, we have a whole body philosophy, meaning we approach your body as one thing, and we understand if you have pain in your toe, it may be related to pain in your shoulder. And the fact that you cannot eat a meal, or every time that you do, you throw up, you're nauseous all the time, that may all be related to each other. And so if you don't have that basic philosophy that, number one, the body is a whole and everything affects everything else, and number two, that your body is amazing, and if you remove whatever is interfering with its innate ability to heal itself, that miracles can happen. If you don't have that philosophy, you're not really approaching this problem in the correct way. Now, since Carlos, we have treated about roughly 300 patients with various conditions. And those conditions may be Ehlers-Danlos syndrome, complex regional pain syndrome, POTS, traumatic brain injuries, strokes, you name it. If the nervous system is involved, we're interested in your condition. Our philosophy is that we remove whatever is interfering with your central nervous system, and then we let your body heal from within. And if it sounds really simple, it's not really simple. Each patient that walks in our door is a puzzle. And while we're now seeing patterns with your group, I cannot say that I've ever had two people exactly alike. And so a lot of experience come into play where you really have to, number one, listen to the patient, understand their history, understand how they got to this point if you're going to unravel this mystery and solve this puzzle. And together with that, you need a healthy dose of what I call the secret sauce. You guys cannot see Kaylee next to me. Lean in real quick, Kaylee.
Hi.
Kaylee did so much to make these webinars possible, but Kaylee is a shining example of what my staff is all about, which is that you cannot be here working with patients for a paycheck. You have to love our patients. You have to be passionate. You have to not sleep well at night if people are suffering. And I can say that about all my staff members. Together with that, they bring vast experience to the table where we've been on the ground with these patients. For example, so we have this whole system, and I'm going to give you guys an overview of that. But one of the things that we do is we either draw blood, if possible, if the patient is stable, or we ask you to bring your blood work with you. When I say blood work, I don't mean fancy tests. We look at the really simple things like a CBC with differential. when we look at that blood work, we've noticed treating the same patients over and over dozens of times that certain things start to stand out. And from a research perspective, I believe this is very, very crucial information for the whole dysautonomia world as a whole, whether you have CRPS or EDS or POTS, it doesn't matter, fibromyalgia. One of the things that we see more and more, I would say more often than not, is that you guys suffer from chronic bacterial and or viral infections. Now, you may think, okay, well, I've seen my doctor, they gave me my blood work, and they said things were fine, there was no problem. The thing is, chronic Epstein-Barr infection is so common in the general population that it doesn't even raise any red flags. The other thing is that there are certain markers that you need to look for, and if you are not familiar with them, especially in your group of patients, you're going to miss those markers. Now, once we find the infection, that is a major roadblock that has to be removed so that your body has the energy available to it to heal from within. How does our system work? Well, my basic philosophy is this. We are constantly obsessed with becoming better. By last count, about 4 months ago, our ongoing success rate, our average pain relief, as reported back to our patients that have left care as far as 8.5 years ago, was 84% decrease in pain. I have not heard success rates like that anywhere else in this world. And you would think that I'm really, really happy with that. But what motivates me is not the 84%, but the 16% that we're not helping. Because behind each one of those 16% is a patient with a story and a family and a life that they didn't get back. And so that haunts me, that drives me. And we're constantly looking to get up to that 100% as close as we can in my lifetime, is what I always say. So we keep our eyes and ears open. We have great connections in what we call the alternative world. And we are always open to improvement, meaning our systems every 6 months usually are different than they were 6 months ago, because we find a new tool and it works better. We replace the old thing with something new that is going to have a better than 84% success rate, because 84% is not good enough. One of the major things we do is we reactivate the vagus nerve. Now, patients will often say, can I do these exercises? Can I gargle water? There are things online that tell me I can activate my vagus nerve. Yes, certainly those are helpful, but in my experience, it takes a major concerted effort of repeated care to wake up the vagus nerve. The vagus nerve is your 10th cranial nerve. It doesn't run through the spinal cord, comes straight from the brain, goes into the trunk, into your abdomen, and connects like tree roots with every major organ from here down to your pubic bone. It affects your bladder, it affects your heart, it affects your GI tract. You guys will almost always have GI dysfunction, meaning nausea, hard time digesting food, food allergies, inability to eat certain foods, and just a general feeling of unease with food. You will almost always have difficulty sleeping at night, and often you guys think, oh, that's because of the pain. Well, yes, kind of, but it's more than the pain. Your automatic nervous system is not able to switch on to sleep. Your automatic nervous system is the nervous system that runs your body without you having to think about it. It just happens. Let's say you are running a race or someone is chasing you. In order for that to happen, blood has to go to your extremities so that you can run. Your blood pressure has to rise. You don't have to sit there and think about that. It just happens. That's called your sympathetic or your stress nervous system. Your parasympathetic nervous system is kind of like the brake in your car. It slows down everything. It helps to digest food. It helps you to sleep at night. It promotes sexual desire. And so with you guys, almost 100% of the time, your parasympathetic nervous system is very, very decreased from where it should be. When you become a new patient here on the first day, we do a very simple test where we measure the space between your heartbeats. And that test tells us which nervous system is being the bully, or are you in balance. And 98% of the time when we do that test, your parasympathetic nervous system will be functioning at 10% or less, where it should be functioning at about 33%. So that's one of the major signs we look for to see whether we think you're going to respond well to care. The vagus nerve procedure is a non-invasive procedure that is, as simple as it is, very, very specific. You may have had, I don't know, 20 upper cervical chiropractors looking at the cervical spine and not been able to have activated that nerve the way this technique does it. And we just developed it through trial and error, trial and error. It is something that you get every single day, multiple times, so that nerve remembers, I'm supposed to be awake, I'm supposed to be awake. Now, what that feels like to the patient, usually within the first 2 weeks, you will have a major, definitive decrease of your pain, enough so that the patient will say, wow, something's different here, something's working. My pain is actually going away in my foot, you're pushing on my neck. So these two are definitely connected. We have a therapy where we hook you up to a DC current. Now, when I say electric current, all of you guys get scared because normally you don't do well with electricity, but this is not like a TENS unit. It was designed with the very purpose of malfunctioning nervous systems in mind. And that current, the effect that it has on the body when you're hooked up to it, is that every single move you do in our office is roughly the equivalent of 250 physical therapy moves or normal exercises. So what that allows us to do, the videos that you see on our Facebook page, just recently we said this patient was in a wheelchair for 7 years, but she just corrected me this week. It was actually 10 years. 10 years, lower body CRPS in a wheelchair, and she just walked 400 feet out of her wheelchair. And in order to accomplish that, your pain has to go down. You have to be able to walk on those extremities, and we have to fight muscle atrophy. If you've been in a wheelchair for 10 years, we have very severe muscle atrophy. Some of the other tools we offer is a tool where we measure your brain function, all the alpha, beta, theta brain waves. And if you have imbalances, the brain is made aware of that, so the brain can see its own mistake and fix those imbalances. And what we find with that tool is if you're stuck in therapy, if we have a hard time having you progress, that tool gets you unstuck. And when your brain can talk to your body, all of a sudden that healing starts happening very quickly. Scar tissue is a very major thing. Now, scar tissue is something we think about, okay, I had a cut or I had surgery and now there's scar tissue. Yes, that's very true. But usually when you have CRPS, for example, in an extremity or fibromyalgia, that muscle tissue is not transmitting force, meaning every time your foot hits the ground, you have a force traveling up your leg into the rest of your body. You have a wave of force. And if any of those muscles are not pulling their weight the way they're supposed to, if you're compensating, walking on the outside of your foot just a little bit maybe, you're transmitting that force incorrectly. And it creates areas, miscommunication in the body where the nervous system isn't flowing the way it should be. That creates scar tissue, and scar tissue does not transmit neurological information the way it should. If neurological information isn't transmitted from cell to cell, your body will never heal the way it's supposed to. So one of the treatments that we use uses sound waves to find that scar tissue and then very gently break it up in a way that you guys can tolerate so that we can go in and treat. That is a very short summation of our treatment system. I know you guys have a ton of questions. Before I take questions, I want to go ahead and present an offer to you. For the longest time, I have been hands-on with patients to the extent where I barely have time to go to the restroom or return a phone call. When I leave my office at night, I have 4 kids at home, and so I head straight over to school. I'm picking up kids, and that was my life, which left me with very little time to get back to my roots. When I first started building my practice and my system, I would connect with you guys personally. I would personally answer the phone, and I have greatly missed that. So when I started this year, I had a New Year's resolution, and I'm proud to say that resolution came true. And this was my resolution. I'm going to make another me. I just hired Dr. Andrew a few months ago. He's been training to be just as good as I am. He's fantastic. He is now seeing patients, and the gift that has given me is time to get back to those roots. And so I am today presenting the opportunity for you guys to book a 20-minute consult with me for $49. We're going to post the link right now if you want to make those appointments, where you'll get to speak to me. I'll get to find out more about you. I can tell you very honestly whether I think you're potentially a good candidate for our treatment, and I can answer your personal questions one-on-one. So are we going to post that link now, Kelly?
And drkatinka.com.
Oh, all right. And the link is also going to be on drkatinka.com. So I'm going to spell that because my name is a little difficult. DRKATINKA. drkatinka.com. That link will be available if you guys want to go book those appointments later. And again, they're $49 for 20 minutes. I look forward to connecting with each one of you. Do we have some time for questions?
Yeah, if you guys have questions, feel free to go ahead and write in, and we'll try to answer a couple.
Okay, Kelly, you know what? I'm going to have you read those to me if you see any specific ones. I want to, real quick, end with a quote. This is one of my favorite quotes. I really want to impress upon your heart today that you cannot give up. You cannot give up. You cannot listen to anyone in any of your support groups that tells you that you cannot get better. Because if you give into that thinking, it's going to be true for you. You have to fight. The people that have rung our bell were fighters. They didn't buy into that mindset. Here's a quote I want you to leave with today. And remember that you being sick affects your children, your husband, your wife, your partner, your parents, your friends, the contribution that you're supposed to give to our world, the reason that you're alive. You were born for a reason, and that reason is not merely just to survive from day to day. It is to thrive. It is to live. It is to be happy. It is to love. And here's the quote I wanted to read to you. It is by Mary Oliver, and it's from a poem called The Summer Day. Doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? Thank you so much for your time. We're going to take some questions now and answer them real time.
So first question is from Carrie. If you have a DRG, does this automatically disqualify you from the types of services that you are able to provide?
No, happy to report that our patients come in with all sorts of spinal cord stimulators. I have someone here right now that actually have 2 or 3 stimulators, one in the thoracic spine, one in the lumbar spine, and one in his brain. And Brent responded beautifully to care. I think he told me this morning his pain, we communicate in numbers here. He said, my pain is a 0.5 out of 10. It is barely there. I can barely feel it. And so Sometimes patients will choose to leave and have those removed. And Natalie with abdominal CRPS just went home 3 weeks ago. And I'm happy to report on Thursday she had her spinal cord stimulator. Yeah, you didn't know that.
No, I didn't.
Yep, removed and woke up from the procedure with absolutely no reactivation of the CRPS. So she wanted it out. Certainly don't have to take it out, and our therapies are not contraindicated for spinal cord stimulators. We do sometimes have to stay off the leads depending on where they are, but we're well seasoned in that world. Great question, Carrie.
Okay. Julie wants to know, have you worked with the SI joint? I have chronic inflammation that makes it difficult to walk.
Yes, so every single, I would say almost every single lower body CRPS patient that comes in will have SI joint problems, sacroiliac joint. That's where the pelvis meets the sacrum. And when you are walking abnormally, and if you have pain, if you have CRPS, if you're on crutches, if you're in a wheelchair, just if your gait is off, those joints will automatically not function correctly. And what happens with CRPS, if you have inflammation, constant irritation anywhere in the body, it's like a kitchen that's filled with gas, and then you're lighting a match, just a little spark. It's going to light the gas on fire. And so that fire is attracted to inflammation. And so wherever your body's irritated, it's going to experience that pain much more intensely than normal people. And so we're very well familiar with SI joint problems, and it's something we have to correct for almost 100% of you when you come in with complex regional pain syndrome. Good question.
Okay.
I like questions.
You're good at answering them.
Thank you.
Okay. MRSA, this is from Corey. MRSA and Epstein-Barr in the past, countless procedures in CRPS after a fall approximately a year ago. Any peer review or studies about walking on the ground? I'm aware without a complete exam, these questions are difficult to answer. Yet, do you use dry needling for myofascial dissection?
No, we do not use dry needling. In the state of Arkansas, it is not legal for my scope of practice to accept to draw blood, to use any therapies that involve needles. And I really try to stay away from that for complex regional pain syndrome anyway. So we don't use dry needling. It's not part of our system. Epstein-Barr, I do see your question's kind of long, but I see that you're listing Epstein-Barr. Epstein-Barr, chronic Epstein-Barr or mono becomes a major roadblock in healing. When I talk about ongoing inflammation, they're doing research now where they find that the vagus nerve is acting as a like a ladder for the virus to travel and the bacteria to use to travel. And when that nerve is infected by a virus like the herpes virus or Epstein-Barr, it will chronically cause inflammation in the body. And so you run into that when you treat the patient. Unless the infection is addressed, you're not going to get the inflammation down and the pain down in our experience. I saw you mention something about peer-reviewed studies. If you go on Google Scholar and you look for chronic pain, dysautonomia, Epstein-Barr virus, or viral infections, you're going to find a lot of research articles. That is definitely picking up a lot of exciting research in that department. As far as my office goes, we are moving in a direction of major research. We're starting with some very serious data collection with temperature changes, edema changes, range of motion changes, pain changes, and we're going to get data reporters, independent data reporters in just to tabulate that information so we can start publishing that because I feel a great responsibility to this world to pass along all these amazing things we're seeing on the ground because I believe that it can help hundreds of thousands of other people.
We're getting a lot of questions. Thanks, guys. I'll take this one. How is it possible to have CRPS when all seems perfect in your life? An 8-year-old girl in great health who has never been sick, just one knee strain, and CRPS appeared 5 days later. Can emotional stress trigger CRPS?
Yes, it can. So you need to go to the Spiro Clinic's Facebook page and look at the genetic video that I just posted, because I feel that that speaks very directly to your daughter's case. Certainly there is a genetic factor involved, but I call that a Pandora's box. You know, you could have twins with exactly the same genetic makeup, and one will maybe have an emotional stress trigger or just a different personality where they process stress differently, and it's enough of a key to unlock that Pandora's box of symptoms. And so certainly there is a genetic component that often comes in play with kids, but there are other factors, and I don't know your specific case, but sometimes that could be heavy metal toxicity, or a vaccination injury, or food allergies, or, you know, mom and dad got divorced and that was the triggering stress. Whatever it could be, there was a factor involved in critical mass being reached for your daughter to become symptomatic, and trauma is not always involved. I noticed a question up there, Gina. I just saw that. You said my daughter's case is very complex. Kaylee, what if we had $10 for each time a patient said, and I'm not laughing at you, I want to give you hope today,
Right.
that my child's case is so complex, or my case is so complex, you don't understand. I'm that other patient. Well, our office consists of those other patients that were the worst of the worst. So full body CRPS with POTS, with EDS, with gastroparesis, with pain from the abdomen when patients eat, or even when they're not eating, that's made much worse when they have their cycles, when they're female patients. We have seen that all. That is a puzzle that we're well familiar with, and you have to get back to basics. You have to get to the bottom line, which is central nervous system, starting from the bottom up, unravel that puzzle and see why her body as a whole is breaking down. But your case is not your daughter's case is not unfamiliar to us, Gina.
Can we keep going?
Mm-hmm.
I see. Let's see. I missed one up here.
I don't want to miss a question.
Okay.
And thank you for all your kind words, guys. We really appreciate that.
Can we send you information ahead of time before the consult? Would that save time and be helpful to you?
Here's the problem. If you're in a different state, meaning you're not in the state of Arkansas, I cannot look at your blood work. I mean, physically, I could look at your blood work and I could tell you a lot, but I cannot advise you specifically based on your blood work if I haven't seen you in my clinic. Because then I'm practicing medicine or chiropractic without a license in your state. Telemedicine is a new area, and legally we're still figuring out a lot of things in the legal world. And so as doctors, our hands are really bound. So general advice, yes, I can give, and I can learn a lot just by listening to your history, but we cannot diagnose based on your blood work without you physically being present in our clinic for at least, you know, a consult. So unfortunately, that is a problem that we deal with.
I just want to remind you guys too, don't forget, if you have more specific questions, please go to that drkatinka.com, and that way you'll have more time one-on-one with her, because we are about to have to wrap this up. We can take one more question.
Pamela has a good question. Where did that go?
Right here.
All right, so your typical day one. We are currently working on a system where our insurance reimbursement is potentially going to be better. And insurance companies will be forced to look at our results and say, you know, you're having amazing results, and perhaps we should pay for this out-of-the-box treatment. So we're doing everything we can to make that possible for you guys. What that is going to look like is unfortunately something we've been trying to avoid, which is a very, very detailed physical exam when you come in. We don't really need that for our treatment because we're not basing it based on your first day exams. All your first day exams tell us is whether you have central nervous system dysfunction, and it predicts whether we think you're going to respond well to treatment. Those are two very simple, non-invasive tests where we're just measuring nerve signals next to your spine, no needles involved, and we have 2 clamps on your wrists or your ankles if you cannot tolerate that, and we measure the space between your heartbeats. So traditionally, that's what we've done, trying not to upset very painful bodies, but now we're going to do gait tests and measurements and temperature measurements, range of motion measurements, so we can start tabulating that data. So that will be about an hour to 2 hour physical exam, day 1. We'll do the other 2 tests, and then on the very first day, we do the vagus nerve procedure to see, can we immediately start dropping your pain? Our number 1 goal when you come in, because you've been disappointed so much, is to hopefully within the first 2 weeks, it's not always possible, but within the first few weeks, we need to produce, it's our job to give you hope. And hope to you guys is, my pain just dropped. And it hasn't done that. And it's not because I took a pill. Something is happening inside of my body. So we aim to deliver that as early as possible. Right now, I believe our waiting list is out about 2 months, I want to say. We've been doing a lot of marketing and much more active marketing. So in the last month, that is starting to build out more and more. So I don't know what the coming year will look like, but right now it's only about 2 months out for the waiting list. And then when you come here, we try to establish whether you're going to be a good candidate very early on. You guys, thank you so much. I hope that I get to speak with more of you one-on-one, because that's where my heart is. That's where my passion is. That's what I love, is to make a difference to lives just like yours. And I can't wait to get to know you better. Thank you so much for taking your lunchtime to watch this today. I had so much fun doing it. Please give us feedback on Facebook. Tell your support groups about these webinars. We're starting to have these once every 2 weeks, right?
Every Tuesday at noon.
With different topics. So it was wonderful having you today. Have a wonderful Tuesday, and please leave with hope in your heart today. Bye-bye.